Jai Hind. In continuation with the educational surgical videos of PERIO Subharti, in today's video, we'll be demonstrating correction of high lingual frenum attachment. So, the word frenum, as you are all aware, is representative of a band of tissue which permits or rather prevents the excessive movement of a mobile organ. Lingual frenum is a band of tissue which actually connects the base of the tongue to the floor of the mouth. So the patient who came to us was a 20-year-old female patient whose basic complaint was that excessive movement of the tongue was not there. She wasn't able to protrude the tongue to a very large extent. At the same time, she wasn't able to touch the palate easily. She wasn't able to touch the palate at all, rather. So on examination, we found out that the frenum was high. It was a bulky frenum which was preventing even normal movement of the tongue. And we decided to go in for lingual frenotomy. Now, with regard to the modality, we didn't opt for the regular blade as such because of the bleeding part which would have been there, which we would have had to control by giving sutures later on. Instead, what we decided was we went in for these thermal modalities. Now, in these thermal modalities, we had a choice between use of a laser and the use of electrosurgery. So, we chose electrosurgery simply because this tip of electrosurgery is a rigid tip. So, I would be able to give my incision easily with a rigid tip of electrosurgery as compared to the flexible tip of a laser as such. But this again is a personal choice. So anybody who prefers laser over electrosurgery, that is a personal choice based on the clinician. It is my choice that I prefer electrosurgery more than laser in cases of correction of lingual frenectomy. So this case of lingual frenotomy, which we did without taking any more time, let us start with the surgical demonstration. So this is the preoperative pic of the patient, the high frenal attachment, as you can see, and this was the amount of movement that we were getting before the surgery. Can you see? This is the video. The patient is not able to lift the tongue to a very large extent. So now we are ready to give the topical anesthesia. So as you can see, isolation is a must before administering of topical anesthesia. Otherwise, it trickles down the throat and the throat gets anesthetized. So we are giving 15% lignocaine. Now we are injecting the local anesthesia using a 30 gauge needle. We are using a cartridge syringe and we are administering 4% articaine. So it has to be given in 3 steps, the infiltration. Right now we are injecting at the base of the frenum on adjacent sides of the frenum. If you inject directly into the frenum becomes distorted, it becomes too bulky. Now we are injecting in the middle part as such. So now what we have done is we have injected in the base and we are injecting in the middle part. So can you see the ballooning which is occurring? The infiltration, the anesthesia has to be kept to a minimum. So this is how we are giving infiltration without directly involving the frenum as such. But since we have to hold the tongue also, the tip of the tongue, now we are injecting in the base of the tongue also. So can you appreciate the ballooning which is happening? This is the area which is most fibrotic. So in this area, what we have to do is we have to inject last. We have to inject in the loosely areolar tissue first, that is the floor of the mouth, then in the center, and finally at the top of the frenum or the base of the tongue. Can you see that ballooning? Now we are engaging the tip of the tongue with a 26 mm needle, 30 suture material. This is just for holding the tongue at the time of surgery, because we need to hold it in place so that we are able to remove the frenum. Can you see? Now we are trying to lift it as such and we are able to visualize the frenum. Now we have started with our electrosurgery. So we are using a needle electrode, and can you see it is completely a bloodless surgery that we are doing. So we are doing a frenotomy, and as and when we are relieving the frenum, can you appreciate in the video, all of you, how the tongue is getting lifted and now it has almost started touching the tip of the central incisors on the top side. So this is what we are doing. This is how the procedure is done, it has to be a very, very conservative cutting. We don't have to go very deep. Otherwise, we'll end up damaging the submandibular and sublingual duct as such. We are just extending the wound a little bit and the procedure is almost complete. We don't have to go very deep. Can you appreciate how much the tongue is coming out now? How much it was getting lifted up? And this is the post-operative pic in which the patient was able to take out the tongue properly. Drastic difference immediately post-op. So this is the pre-op and the post-op views from the side, lateral view, and this is the frontal view. So can you appreciate that how much the tongue has been lifted? So this was a small surgical demonstration of the correction of lingual frenum, high attachment, that is lingual frenotomy, by the use of electrosurgery. This procedure was performed by Dr. Yashika under my guidance and it was documented by Dr. Vasudha. So this is all from team PERIO Subharti for the time being. Till the time our next educational surgical video comes, do like and subscribe to our YouTube channel. Thank you. Jai Hind.